Hey everybody, Doc LeGrand here, and today we're going to be talking about specifically why your ADHD supplements don't work for you. So there's a lot of reasons of why it does not work, but probably the main thing that I see of why people struggle with supplements working for their ADHD is because they're going about it all wrong. They're just going at it blindly, completely not understanding why it should work for them or should not work for them. And the very first thing that we have to look at is, why are we taking it in the first place? Like, what's the whole purpose of taking these different supplements? And we have to first do investigative work before implementing anything. I think it's where people get this backwards, is they just try any kind of supplement and hope for the best without doing any kind of lab testing to understand what's truly going on. So the very first common supplement that I do see people take is something like tyrosine, L-tyrosine. It's also in a lot of different combination and blends of different nootropics. And a lot of people think that this is the issue. And, you know, it makes sense. Like, this is something that starts pretty fairly beginning of the dopamine pathway to help support improving dopamine. So either you're probably taking something like L-tyrosine, but a very common one that people do love and ask me about is Alpha Brain. I've heard good results for people, but sometimes people just don't find that it helps them. And, you know, one of the big blends that they have here is L-tyrosine. They have L-theanine, they have phosphatidylserine, they have a lot of good things in here. But if you don't need it, you're probably not going to see much of a benefit from taking these. So let me explain. So if, you know, just from another patient that I did some amino acid testing to see, okay, do they really need something like tyrosine? And you can see that their tyrosine levels are elevated. And this was also even for my case when I was doing these tests. And I tested out taking tyrosine to see, okay, is there a difference? Will I see a benefit in it? Well, you're not going to see a great benefit, or sometimes it can make things a little worse if you're already elevated in these levels. And you're not going to see anything. Or even if your levels are like right here in the middle or something like that, and it's already normal, you're not going to see anything. And this is why people get so frustrated with supplements and trying to use it to help their ADHD, because they haven't looked to see if they're imbalanced at all. They just don't do any labs, and they're just like, okay, hope for the best. But if you look at this test, like with this patient, the thing that was low was their phenylalanine levels, which is an excitatory neurotransmitter, which starts at the very beginning of the dopamine pathway. So things that I do highly like to recommend is something like Phenylalanine if someone is deficient in this area. And with this particular patient and many of my patients I work with, when we see that and we add that, it makes a drastic improvement. When we don't focus on something that they aren't needing, but focusing on something that they do need. And this is why you're probably really struggling seeing that ADHD supplements are not working for you, is because you're going about it all wrong. Another very common one is we go kind of further down to really directly helping dopamine, is helping and improving like dopamine levels. L-Dopa, right? So there is a couple, like I've even recommended this one a lot, Dopa Boost, because it has mucunapurines in it, which has 60% L-Dopa. So, it's a great one. I do love using that one, but I don't use it for everybody, because I like to look at labs first, because if we see like with this patient, their dopamine levels are too high. Even, the breakdown of their norepinephrine, there's no issues there. It's a little elevated there. So why would I recommend something that's going to increase it even more? Because I've seen this time and time again, even with people who are taking medications, when this is already elevated and you just start increasing and adding more things to increase that, it's going to give you the opposite effects that you want. And they're going to be things like feeling agitated, irritated, high anxiety, and stress. Definitely something you don't want to be in that situation. So I would not recommend something like that if your test results come back like this. It's just not a good situation to be in. So this is why it's so critical to look at testing first before you decide to take some random supplements. Do some investigative work of your own individualized medicine, your own body chemistry, to see if you really need to take it. And so what I would recommend is, if you are having if you had test results like this, where your dopamine and norepinephrine and some other levels are a little too high, is adding something like rhodiola and L-theanine, because both of those have proven to naturally help calm the nervous system down and bring those dopamine levels into more of a healthier balance to where we want them. Okay. So like those are like some really critical things to kind of like think about when you're deciding to choose supplements for your ADHD. Is it's important to do some investigative work beforehand. Another very common one that I get asked out asked out asked about a lot is ashwagandha. Very popular. I have a couple of videos on this, and people use this for a lot of reasons, but they also use it for their ADHD and hoping that it can actually benefit them. Now, the problem with this and why this actually can really cause some severe side effects, which I think some of you guys have actually, let me know in the chat if you've had bad experience with ashwagandha, where you felt when you were taking it, you felt a little bit drowsy, groggy, a little bit more depressed, a little bit just kind of off. Let me know in the chat, because it's definitely very common. We're seeing it more and more of an issue because ashwagandha is so popular right now. And so everyone's just taking it, and not everybody's getting a great experience with it. And my belief in why this is happening is because ashwagandha is known to lower cortisol. So it's very effective in lowering cortisol. So it can really help with stress. Okay. But what if you already have low cortisol levels to begin with? And I will argue probably half, if not more, of the population have some shape or form of cortisol issue where it's actually low, just like this patient was. Throughout the entire day, their cortisol levels were low. So you add something like ashwagandha, they're going to feel really bad. They're going to feel even more tired, feel more depressed, mood. They're going to like those kind of experiences that people have been having with ashwagandha. Even my own experience, I don't recommend people do this, but I purposely took ashwagandha knowing that I already had low cortisol levels, but I wanted to see if it did make things worse, and it certainly did for me. Now, a lot of people debate on that in that video because I took too much or whatever, but I was trying to prove a point that you just don't take something without doing some kind of lab testing to justify the reason. And I was doing lab tests to show that, yeah, I should not take this, but I'm going to show to you by taking this, things are going to get worse. And they certainly did for me. So another one, and so like what you do in this situation, if your cortisol levels are too low, then you need to be, for like a good 2 to 3 months, is adding some adrenal supportive stuff like adrenal desiccated, adrenal support by Vital Nutrients is another one I really like using because it's going to revitalize the adrenals to be into more of that healthy balance where we need them to keep to keep us awake, to keep our energy up, and to managing our stress. Now, if your cortisol levels, are spiked, like in any part of the day, like ashwagandha can definitely be really beneficial to you for sure. But this is why it's so important and vital to look at some for the testing to really justify, should you be taking this or not, right? Now, another really popular one that I do get asked about is qualimine. So the reason I don't particularly use blends, like where there's several different types of nootropics and supplements within one capsule, probably the one thing is they usually can't put enough in a capsule. The other thing is there's usually things in the blend that are going to make things worse than better, and there's a few things that will make it better. So, like for example, if we take qualimine, for example, it has N-acetyltyrosine. Great. But what if you are someone that already has elevated tyrosine levels, like I talked about at the very beginning with this patient right here, right? I wouldn't want to add that. It can make things worse. And, what if, I didn't talk about this, but what if your taurine levels are too high? Again, not maybe the best option. What if we don't need to use, so this is the thing, it's doing kind of two things. Like I don't usually recommend rhodiola if there is a cortisol situation, unless I want to lower the cortisol. But what if your cortisol levels are too low again? So there's too many things in here that can make things worse or better. Now, I know people get good results with qualimine, probably because the biochemistry is where it needs to be to get those benefits. But there's certain things in here that can make things worse if we find it through your lab work. So this is always why it's so important to understand, especially with blends, that everything in it, like all these things, all these ingredients are great, but it's not going to be necessarily the best thing for you because it can make things worse, making it too much for you or not enough. That's another thing. Like when you have this high a blend of amount of things, it's not going to be a very high dose. Like for example, if I did need to incorporate N-L-tyrosine or taurine or L-theanine, 200 milligrams, and this is 7 vegetable. I didn't even realize that. Actually, now looking at this, you have to take 7 capsules to get 200 milligrams. That is not even close of what you would need if I need to incorporate something like tyrosine or even L-theanine or even taurine. Like if I need to incorporate those and we saw those were deficient, doesn't even hit it. Not even close. You have to take 7 of those. I realize how much you have to take just to get that. This is why when you see like a huge combo of several ingredients, like they're all great, but they usually cannot fit enough in a capsule. So you've got to like dump like 10 capsules to even just touch the surface. But if you're deficient in it, it's not going to cover it. And this is why I usually like to focus on like usually 1 or 2 ingredients. If there's a blend, I might have like 4 or 5 ingredients because all of those ingredients in there are what I need you to be taking, specifically because we found a deficiency in every single one of those areas that are going to benefit you. So hopefully this is kind of like sinking in. Hopefully this makes a lot more sense. Let me know in the chat if this is making sense to you, helping you understand why your EDC medication or your EDC supplements haven't been working for you. And now you have a clear picture of how it can work for you. So, what can you do? Well, this is where, me and my team come in to really help you identify what is specifically deficient in your body chemistry. What is specifically deficient with your ADHD? What is the root cause of your problem? Because it does require further investigation to understand what is really going on with your ADHD situation. And so because doing this alone and going about it all by yourself, it's not easy. You've probably been doing this for years trying to figure this out, and you just don't know what to look for. And so here's why, it's helpful to have someone on your hand. So you need help to find the source of your imbalances in your body chemistry, especially to identify the root cause of your ADHD. You also need a more customized plan that's very specific to you of your individualized needs so you'll be consistent with it and actually tackle the root cause of the problem. Third, you do need someone who is going to actually hold you accountable to assess and analyze and adjust that treatment plan so you can be consistent with it and so you do get the results. But so here's exactly, how I can help you. My health experts, have set aside a time to speak with you personally to help you actually start getting results now. So it's called the Focus Mindset Strategy Session. And so on this Focus Mindset Strategy Session, we'll put together a specific plan for your situation to help you have better focus so that you can actually excel in life. And then here's exactly how we'll do this together. First, we'll uncover behind your ADHD symptoms, and it's your blind spot. It's something that you are missing and not knowing what to see. And so that's where we come in to be able to look at your medical history to see what is missing here. And it's most likely not what you've actually been told it is. Then we'll customize a plan that is very customized to you that will get you unstuck. And finally, we'll determine if it makes sense for us to work closely together. And so what we're offering is a focused mindset strategy session with one of my health experts. And so this includes a 45-minute one-on-one personalized strategy session it's a value of $750. And then you also get access on top of that, our nutrition and lifestyle tracking app that we use with all our patients and clients. That's a $300 value. And then also if you do purchase today for the first 5 people, you get access to my ADHD health course. That's a $597 value. So you get all of this. It's a full value of $1,647. You can get all for today for just $297. So all you got to do is click on the link in the description below. And so it'll be right there. You'll click on that link in the description below. Once you click that, it'll take you to this page. You'll purchase. Once you purchase, this is very important. You got to book your appointment. So once you purchase, then you're going to hit book now. You'll pick your date and time that works best for you. And then you'll fill out your information. And then this is really important. You'll come to this landing page. Please check your email to make sure you got your confirmation appointment as well as the email from Practice Better. This is our online client portal. This is where you'll get access to the nutrition and lifestyle tracking app. It's also where you'll fill out your client questionnaire to be able to make sure that you fill that out and so that we can see that beforehand so we can determine what labs would be the best as well as what action plan. So it's very important that you fill that out. If you have any labs in the past year or so, You can always upload those too. If you have like just standard labs from your doctor, you can do that as well. And then make sure to book out 45 minutes to an hour. Sometimes we might go a little over. So you're the health expert that will meet with you. Sometimes they go a little over if you have additional questions. So please block out a full hour needs be, and then show up early, show up on time. We do give you a 10-minute grace period. If not, we have to mark it as a no-show. So please do show up on time. Also, we do require that your significant other or spouse is present there because we do want to understand the ins and outs of your challenges from an outside perspective, from a significant other or spouse, so we get a little more clarity of your situation. So please have them there. So, if you are really wanting to tackle your ADHD for good and actually get to the root of the problem, this is the best natural step to be able to take. And we would love to help you out. So all you have to got to do, again, is click on that description below to book that consultation with us. Thank you guys so much for attending, and I'll see you guys in the next live stream. Thanks. Bye.